One of the biggest challenges in the Nigerian health sector, according to Global Health Workforce Alliance, is how to build and sustain a pool of skilled human resources. Their session is not new to the Canadian Association of Nigerian Physicians and Dentists, CAMPAD, as they converge for the 15th annual conference in Edmonton, Alberta, Canada, to deliberate on the issue of palliative care, collaborating with the health sector in Nigeria to address some of these problems is a major item on the agenda.
Right now, we're spending between $1 to $2 billion, according to the previous health minister. $1 to $2 billion US on health tourism, whether it's going to India or going to South Africa. These are skills that are already available in Nigerians, whether at home or in diaspora, and we can give back.
They're looking at the Memorandum of Understanding signed between the Nigerian Federal Ministry of Health, CAMPAD, the sister organizations in the United States and the United Kingdom a few years ago, and the way forward with the current administration.
When you talk about surgical issues, how many things are available as under the government to the general public? Some of the things that are extremely expensive. CAT scan, MRI, investigations and other radiological services, access to laboratory tests that may be helpful in making diagnosis, treating patients and doing appropriate follow-up, are those readily available. And with that in mind, we continue to be very eager in many ways to see how much we can do to improve the situation.
The area of cooperation is not just limited to the federal government. There's a lot that needs to be worked out locally, and unfortunately, a lot of medical facilities, such as we see in the other countries that some of our members have been to for medical missions, are actually lacking in Nigeria.
What can be done to address the issue of cutting-edge medical technologies for hospitals in Nigeria? Can the private sector assist the federal and state governments in solving fundamental problems? The answers to these questions will be in the second part of the report. In Edmonton, Canada, Joy Osiagwu, NTA News.